Hujambo, beautiful people, and welcome to Espresso Talk Today, the Black Empowerment podcast show where we dive deep into the real and raw reality of confronting the chaos of living Black in predominantly white spaces. Today's predominantly white space is the healthcare system. I'm your host, Amma Robin, and today we're diving into a critical conversation about racial chaos in the healthcare system. This isn't about only those big and obvious moments of racism. It's about the subtle, sometimes hidden ways that racial bias and racial discrimination show up when we visit the doctor, go to the hospital, or just try to take care of our health. In this episode, we're going to talk about the red flags, those warning signs that racial chaos is showing up in your healthcare treatment. It might be waving around in the doctor's office, but we often fail to recognize it. This isn't your fault. Bias and racism have no place in the doctor's office or any aspect of the healthcare system, but it is there. And the red flags are waving. I'll be giving you today real examples of what to look for and how to recognize when your treatment might be compromised by bias or prejudice or just outright racism. This episode will empower you to identify those red flags so you can take control of your healthcare. And in next week's episode, we're going to talk about how to confront these situations when they do arise. And yes, there are ways to do it. Today, I am sitting back and sipping my turmeric cinnamon pepper coffee for this uncommon show. But before we dive in, hit that subscribe button if you haven't already. And if you're feeling this show, share it with your fam, your crew, your circle, your tribe, everyone in your community. Okay, here's a serious moment. Trigger alert. We will be discussing real-life examples of medical racism and racial chaos in the healthcare system. Some of these stories and situations may be triggering or distressing, especially for Black listeners who have experienced racial discrimination in healthcare. I know when I was writing this and thinking about it, I began to get some symptoms. I began to get, shallow breathing and began even to tremble and began to get angry. So I know exactly how that feels, and it is real. So please take care of yourself. Feel free to pause or step away if needed. Your feelings are valid. Your experiences are real. You are not alone. Now, grab that espresso or tea. Tea drinkers are very welcome here too. And close that door behind you. We're going to get deep and we're going to get real. And I hope that y'all are ready for this. Aquaba, my dear brothers and sisters and gender neutral and gender nonconforming folks, I am so glad that we are here today for this uncommon and perhaps even distressing show. But we are here together, and that makes us powerful. Let's start with a quick overview of what I mean by racial chaos in the healthcare system. Yeah, you might be thinking, chaos and racial chaos? Oh yeah, absolutely. I'm just going to say something brief here, but we're going to go through this all today, and at the end of the show, you're going to be like me and maybe shaking your head. This term, racial chaos, refers to the deep, pervasive presence of racial bias and discrimination in medical spaces where doctors and healthcare providers make assumptions about Black people that affect how they treat us, how they diagnose us, how they look at us, and ultimately how they care for us. And it affects the level of humanity they treat us with. Here are a few statements, that we're going to discuss a little bit later, but I'm going to throw them out now so you kind of know what I mean. And these are direct quotes, real life situations. We're always being real here. Black patients are more likely to abuse drugs. The data doesn't show that, but that's what people believe. And when they're believing that, how do you think they're looking at you and treating you? Well, people are going to be different, but they definitely look at people that they think are abusing drugs and they're Black differently than how they look at white people who may be abusing drugs. Another one, Black men are more aggressive or combative patients. Have you heard that? Better question, have you felt that? Here's the third one. Black mothers can endure childbirth without as much help. What do you think? Yeah, I have felt that. And I can tell you it's painful on many different levels. We're going to come back to these statements, but I just wanted to throw them out right now so we kind of know we're on the same page. We kind of know what we're dealing with. I haven't had these statements said outright to me. That's true. But I have seen that they're in the heads of certain healthcare providers like doctors and nurses, even the intake person at the emergency room. I have felt these statements. But racism isn't just about the interpersonal interactions that I just mentioned. Racism is so deeply embedded in the structure of the healthcare system. It's very deeply embedded. And it influences how Black people, us, are treated, diagnosed, and cared for. This structural racism manifests through inequality in access to quality care. Yes, that's right, the unequal access to quality care. It manifests through acceptance of implicit biases among healthcare providers. Some of these implicit biases are that Black men are more aggressive or combative. And the historic exploitation of Black bodies in medical research. We can go back to the Tuskegee, experiment, but honestly, we just don't have to go that far. Another example of structural racism in healthcare is the exclusion of Black people, our exclusion from clinical trials. Historically, medical research has often centered on white Eurocentric standards and people, leaving out other populations, actually majority populations. As a result, medications, treatments, and diagnostic criteria are often developed based on data that don't account for, biological differences or specific healthcare needs that we as Black people have. Here's an example. Certain conditions like hypertension or sickle cell anemia disproportionately affect Black communities. Yet research and treatment and, of course, funding and treatment strategies often don't fully reflect these realities. This exclusion perpetuates healthcare disparities and limits the effectiveness of treatments for Black people, for Black patients. That's right. When we're not in medical trials or when we're excluded from medical trials, they're not developing medications that have our unique, kind of biological, makeup. And often we are excluded just because, maybe our, potassium is at a different level, than a white person's. That's true. And that, in many cases, can lead to poor health outcomes and maybe even death. Systemic racism in healthcare refers to the policies, practices, and institutional norms that disproportionately disadvantage us within the medical system. One example is how our communities often lack access to high-quality medical facilities. That's right. And this leads to healthcare deserts where preventative care, specialists, and advanced treatments are just not available. Another way, hospital policies around pain management, particularly during childbirth, often result in Black women receiving less pain relief or having their concerns dismissed compared to white patients. This systemic inequality not only affects individual patient outcomes, but it also continues a cycle of poor health outcomes and the distrust of the medical system. And see, that shows that it's not that we're just out there being distrustful. The healthcare system has earned a lot of its reputation and its distrust, and it's not doing enough to try to change it. Now, here's a different one that we often don't discuss very often, but I decided it's important to bring it up. Internalized racism. Have you heard of that? Yes, and this occurs, internalized racism occurs when we as Black people unconsciously absorb the negative stereotypes, the biases, and the beliefs perpetuated by the dominant majority, white society. And then we apply it to ourselves or to others within our communities. I'll give an example. In healthcare, this can manifest as Black patients downplaying our own symptoms or believing that we deserve less care or feeling hesitant to challenge a doctor's dismissive treatment. Another example is, when a Black person might avoid seeking medical care for fear of being labeled difficult, or might believe that experiencing high blood pressure or chronic pain is just a part of being Black. That's just not true. Or it's really rather a condition that deserves proper treatment, but instead we dismiss it as, well, that's just part of Blackness. It isn't. It is not. And I hope that you heard my discussion with Dr. Clyde Yancey about this, because he said it's not about race, race is only involved as a factor of racism. That's right. Factor of the racial chaos. So confronting and unlearning these harmful beliefs is essential for both personal empowerment and for improving health outcomes. But I wanted to stick with internalized racism a little bit longer before going on, because it's a little bit confusing. And honestly, this is not about judging or saying that anyone's weak or racist against themselves. It's about understanding what's going on. Okay, so another one is when we distrust our own ability to understand complex medical information. I mean, everybody feels a little bit, who's not in the medical field can feel a little bit, that, I don't know if I understand that. That's absolutely normal. But to kind of think, and got to be honest with ourselves, well, we, as a Black person, I don't really understand that, and that's not anything about race. That's about, not trusting yourself, but that's about the internalized racism that says and perpetuates and promotes, and you keep hearing that Black people don't understand complex, situations or treatments. Not true. Okay, this belief is actually rooted in history where Black voices are marginalized and were marginalized and undervalued. And it can result in patients accepting treatments or diagnoses without fully understanding them. Even when, we feel that something's wrong. We think, oh no, the doctor knows better. Don't trust that. For instance, a Black patient might hesitate to ask about alternative treatments or question a doctor's recommendation due to an ingrained belief that we are less knowledgeable or deserving of a thorough explanation. And this really limits our ability to advocate for ourselves. But no worries. We're going to go into all of that in the next episode. Just remember that for many of us, navigating healthcare can feel dehumanizing. You're definitely not alone in that feeling. And it's not just overt racism, it's the unspoken assumptions, the stereotypes, and the systemic inequalities that impact our experience. And unfortunately, it can also be, and it is, mostly I think, very subtle, which can make it harder to recognize until the damage is done. And we don't want that. That's what this show is about. Now, do you know what time it is? That's right. It is time for our first breather break. This gives us a chance to breathe for a minute. When things get intense or get confusing or we have something to think about or you want to dive deeper into it, breathing helps us to do all of that. I hope it helps you too. I will see you in a minute. And just sit back, because I'm going to sit back, because you guys know I love this song.
Yeah. Trying to get a lot of dough and dirt through all the obstacles, cause anything is possible. Yeah. Oh man, I got a lot of goals. Stack that bread and by my nose. Anything is possible. Yeah. Trying to get a lot of dough and dirt through all the obstacles, cause anything is possible.
Aquaba back, my dear community. Welcome back. This is Amma Robin, and I think we're ready now to dive into the red flags of racial chaos in healthcare. So grab that coffee or espresso or tea, and let's get to it. Okay. You know that the red flags are signals that racial chaos may be affecting your care. Or, you may see these red flags in your doctor's office or when you walk into an emergency room and at the intake or when the nurse is there in the room with you, or it can happen anytime in the healthcare journey. So that's why we have to be aware, which is why we are talking about this, why we've talked about it all month, and why we're going to keep talking about it. Now, these are real-life examples that you might have experienced yourself or heard about from friends and family. And some of these are going to be personal experiences for me because, I'm into complete openness here. And I'm ready to start story sharing. No more silence on these things. That just protects the system. Silence protects the oppressor. You know what? I'm going off. Here we go. I have removed the names to protect people's privacy and dignity. And yes, I do like privacy and dignity for myself too, but as I said, I'm story sharing today. Understanding these red flags can help you to spot racial chaos when it shows up in your health journey, whether it's in the doctor's office or in the ER intake or in the pharmacy or anywhere else, but before it harms your health. That's the real trick. Often we see it after we leave. Often we see it in hindsight, and that's never too late, hopefully. But it's better to spot it as early as possible. Let's begin. Red flag number 1, dismissal of your symptoms or your pain. One of the most common ways that racial chaos shows up is when doctors dismiss or downplay your symptoms, especially pain. For example, a black woman in labor might be told she's overreacting, or a black man with chest pain might have his symptoms attributed to anxiety or stress, or a black child might be given only minimally effective anesthesia for pain when getting stitches. This is a dangerous red flag because untreated pain or symptoms can lead to worsening conditions or even death. Pain is a signal. We have to pay attention to that. Here's a specific example, but as I said, I'm taking away names. A black woman experiencing severe chest pain or migraine headaches is told by her doctor, it's probably just stress. Take some aspirin or Tylenol and rest. Okay, you all know this was me. Meanwhile, a white patient with similar symptoms is immediately sent for tests like an EKG or an MRI. Okay, in full candor, I was offered to get a spinal tap. But this was a teaching hospital, and I think they were just out there practicing and fishing. They weren't doing this for my benefit, but for theirs. So, yes, I did turn down that offer, but, it's my choice as a patient. Red flag number 2, lack of thoroughness in diagnosis. Another red flag is when healthcare providers aren't thorough in diagnosing your symptoms. You can tell if they're rushing through your exam or sometimes they skip critical tests. You might not know that, you might, or they don't refer you to specialists, or they don't mention dangerous symptoms or signs. And that is a red flag that they might not be taking you seriously as a patient, or that they are deprioritizing you because of race. Example, a Black person goes to the doctor complaining of dizziness, vomiting, and fatigue. But instead of ordering tests or checking for other potential causes, the doctor just prescribes over-the-counter meds and sends them away. And this might be a sign that they're not doing their due diligence in your care. Now, this actually happened to someone I knew who was later determined was experiencing a stroke. They were saying, oh, they have vertigo. We'll probably just give them some meds and send them home. And I was thinking, wait a second, sudden onset of vertigo, and you just send them home and give them some meds and send them home without examining more deeply? Well, we pushed harder, and that's when they discovered that he was having a stroke. Red flag number 3, making assumptions based on race. Doctors often make assumptions about Black patients based on racial stereotypes. One of the most prevalent ones is that Black people don't feel pain the same way white people do. Another assumption is that Black people are automatically at risk for conditions like hypertension or diabetes without fully exploring other potential causes or symptoms. Example, for instance, a Black patient complains of feeling weak or dizzy, and the doctor immediately assumes it's high blood pressure without doing any other tests. Well, that could be okay if the, blood pressure is really, really high, but they might say it's common for Black people to have high blood pressure instead of checking for other causes. When the doctor makes a treatment plan, like medications or something, based on that assumption without knowing the patient's real condition or medical or family history, this can cause other very serious problems, and they're not being thorough. Red flag number 4, making patronizing or disparaging remarks. Oh boy, this one really hurts because I think maybe we've all experienced this one. These microaggressions and offhand comments from doctors or nurses can also be a sign of racial bias. These remarks can be subtle but deeply dehumanizing, making you feel like your health concerns are being minimized or ignored, and that you are not being treated with the respect and dignity you deserve. Okay, I think y'all know this was mine. A nurse who was unable to place an IV says, oh, well, Black people have thicker skin, so it's harder to find a vein. This kind of comment is not only false, but it reinforces harmful stereotypes about Black bodies. This was my experience. And so what did the nurse do? Well, she didn't give up putting in the IV, but she put it in the back of my hand, which was especially painful, and didn't just go in and come out. It was staying in there for 5 days. So, that's because she just made the assumption that that the problem wasn't her, but that the problem was my Black skin. Ooh, boy, just thinking about that just brings me into a rage. It makes me so angry. But at the time, I just didn't say anything because I felt so vulnerable. And she was so adamant in her thoughts. And I'm sure she still does believe that too. She probably learned it in nursing school. Whew, I thought I was going to continue on a little bit, but I think it's time to take another break here. Let's take a minute to breathe or think or stretch, do push-ups, grab some coffee or tea or whatever speaks to your soul. This is important stuff here, but we all need a short break. When we return, we're going to come back to discuss 4 more red flags of racial chaos and what they mean. I'll see you in a minute.
Yeah. Grind to get a lot of dough and dirt through all the obstacles, cause anything is possible. Yeah. Oh man, I got a lot of gold. Stack that bread and vomit nose. Anything is possible. Yeah. Grind to get a lot of dough and dirt through all the obstacles, cause anything is possible.
Hi, it's Amma Robin. We're back. Let's get right to it. So, let's see. Red flag number 5. Reluctance to explain treatments or provide alternatives. If a doctor doesn't explain why they've recommended a particular treatment or they gloss over alternatives, it could be a red flag that they're not giving you the same level of care or consideration as they would give to others. I mean, some doctors just have a terrible bedside and a terrible, bedside manner, and a terrible way of interacting with patients. But you can kind of tell when there's a difference, okay? And some doctors, of course, they just haven't developed that patient-centered bedside manner. But you can tell when it's not just that, but that they're just dismissing you. And many doctors just need to be pushed to answer questions. However, many doctors also operate under the belief that they're superior and that black folks are just ignorant, so they won't take the time to explain treatments or alternatives. It's also about treating you with respect and dignity. We're going to discuss this racist mindset more in a few minutes, but let's look at an example. Now this is just an example, you've been prescribed a new medication. But when you ask about the side effects or other options, the doctor becomes defensive or dismissive, saying things like, "This is what I always give my patients." You deserve to have your questions answered and your options explained, and you deserve respect. And this fits none of these requirements. And doctors often do feel, and it's not just doctors, sometimes it's the pharmacist, sometimes it's the nurse, sometimes it's other people in the healthcare, system that are just not giving you the same respect or consideration because they feel they don't have to because you're black. Red flag number 6, pressure for certain treatments. If you feel pressured into accepting a specific treatment without a full discussion of the risks and benefits or alternatives, this could be another red flag. For example, a doctor pushes you towards surgery without discussing non-invasive options or explaining why the surgery is necessary. This could be a sign that they're not respecting your right to make informed decisions about your body. And I know that this has happened and continues to happen with many black women who have fibroids, especially black trans women and black lesbians. They're often pressured to have a hysterectomy. And sometimes, many black patients are pressured to have an amputation. So, we're talking about serious life-altering surgery that isn't explained and that you're not given other options as well. Red flag number 7, ignoring cultural or personal concerns. When a healthcare provider dismisses cultural or personal preferences related to your treatment, it's a form of racial chaos that can undermine your care. And it's also not treating you with the dignity and respect that you deserve as a patient. Patients are not just compartments, we are whole beings, and they have to work with the whole person that comes into, that they meet in the office or wherever they meet them along the healthcare journey. So, for example, you mentioned that you like to explore alternative treatments or you have dietary concerns related to cultural background, but your doctor brushes them off as unimportant. Well, this shows, for example, like you don't eat pork. I don't, for example. Or that, like, I'm on a vegan diet. And the doctor brushes that off that, well, that's not going to fit with this kind of treatment. Now, this shows a lack of respect for my lived experience and my personal needs. It also shows a disrespect for my culture and a preference for European culture and cultural norms. The reverse is true as well, by the way. The reverse is true as well, yeah. Cultural practices or stereotypical cultural practices are often assumed. I remember when I was pregnant and I was living in Sweden, I wanted to know the gender of my unborn child. The Swedish midwife refused to authorize that procedure. Why? Because she said, oh, you want to have a boy. I said, well, I don't know. I want to have a child. I don't care about which gender it is. I just want to know. But she assumed because I'm a black woman, and she thought I don't know what she thought. But anyway, I'm a black woman. She was a white woman. She assumed I wanted to know the gender and that I wanted a boy. And if I wasn't going to have a boy, that I was going to have an abortion. I was going to abort the fetus. Now, I completely believe in a woman's right to choose how she handles her body and how she handles her pregnancy and all of that. But that was not my intention at the time. I just wanted to know the gender so I could mentally and emotionally connect more with my unborn child. But because she made this assumption and she didn't believe anything that I just said, because I told her this, she wouldn't authorize the procedure, to learn what the gender was. Now, later on, I went to a different place, and they didn't hesitate to, let me know the gender of the baby. So, anyway, so that's how cultural norms, or cultural stereotypes can, affect care. And also, it's a hierarchy as well, because this nurse, the Swedish nurse, felt that she could know better what I needed and what I should do more than I knew about what I wanted and what I should do. Now, red flag number 8. This is the last one. Lack of follow-up care. Wow. Yes. Sometimes you don't even expect that because it's offered so infrequently. If a doctor does not suggest follow-up appointments, additional tests, referrals, or give you guidance on how your condition should develop when necessary, this is a red flag that you might not be getting the full scope of care. This is called undercare, which I discussed earlier in an Instagram Live and in a different podcast show. Just when, you leave the doctor's office or you leave the hospital or whatever, that should not be the end of your care if your condition continues. Particularly, this is true for people with chronic illnesses. For example, a black woman has ongoing symptoms and the doctor tells her it's nothing to worry about, and the doctor doesn't schedule any follow-up appointments or referrals to a specialist. This can prevent her from getting the care she needs and deserves. Healthcare happens both in and outside the doctor's office. It's a red flag if the doctor does not give you the full range of care or give her or anyone the full range of care. That care is often easily accessible to white patients. Yeah. So I think this is a good time to take one last breather break. This has been intense, and the intensity is not going to go away just yet, and it's been difficult to recall and discuss. And I want to just quickly present you with some other real-life statements by healthcare workers that show their bias and racism. These statements are important because these doctors or nurses or healthcare workers are treating you based on their beliefs in these statements. They have an effect, sometimes life and death effects. After reviewing these statements, we'll begin to wind it down. But be sure to take this time to breathe or stretch or engage in your own self-care activity. They really do make a difference. I'll see you in a minute. welcome back, my community. And I am so happy that you've stuck around this long, to discuss these issues. I know they're not easy, and I know it's not that fun either, but it's so important because our health is our empowerment. Without our health, there really is no empowerment. So we're going to just dive into a few, five exactly, kinds of, mindsets and quotes. These are actual quotes, and that you may have heard or that you may hear. And these are also red flags, but they also let you know what you're dealing with. Okay, I've mentioned a few already, like Black patients are more likely to abuse drugs, Black men are more aggressive or combative patients, and Black mothers can endure childbirth without much help. Well, we've mentioned those. Oh, okay, and of course, Black people have thicker skin. Well, my God, when I just hear that, I just really cringe. So, those are some, statements that represent the mindsets that show the racial chaos in healthcare. But we're going to just do 5 more now. We're just going to discuss those a little bit, and then we're going to wind it down. I just want to mention these because I know it's getting to be long, and I know this is that we're all busy, but it's important just to be able to recognize these things if you hear them. Okay, so I think then, without further ado, let's get right to it. Let's see. Oh, I've heard this one a lot. Number 1, Black people are predisposed to diabetes and heart disease, so it's not preventable. Well, not true. But I've heard this from healthcare professionals. This fatalistic assumption can cause providers to dismiss lifestyle interventions or more personalized care, relying instead then on the broad generalizations about race. This can prevent us from receiving comprehensive support for managing or preventing these conditions, based on our individual circumstances. So race does not cause, diabetes or heart disease. It's the racism that really doesn't, it's a contributing factor to it. Okay. So when you hear healthcare professionals say that, we got to go, not true. Number 2, Black patients don't adhere to treatment plans. Well. Dr. Greg Hall talked about this because there's an issue of trust. And in many ways, the healthcare system hasn't earned the trust. The doctor, the healthcare provider may not have earned the trust of that patient. Let's go more deeply here. And this stereotype implies that Black patients are more likely to be non-compliant with prescribed treatment or fail to follow medical advice. This may result in providers giving less thorough examinations and explanations, limiting follow-up care or not even offering it, or making fewer efforts to ensure that the patient fully understands their treatment options. People don't go to the doctor because they want to. They go there because they need to. And if you feel that, they're not going to adhere to the plan, maybe the healthcare provider hasn't earned the trust. So maybe they need to spend more time with the patient. Okay? Number three. Black children are tougher or less susceptible to illness. Where did that come from? That one has to be something that just comes from slavery, from the period of enslavement, when Black children, anything could happen to them, and it's also about adultification. That's another thing that we discussed, kind of a long time ago. Maybe I should bring that one, discuss that one again, because this is really dangerous for children. And I know that my son, when he was a lot younger and he went to a healthcare provider, they often, didn't think about giving pain management, or treating with, kind of a gentleness that children need when they're in a hospital and they're afraid. But let's say this stereotype really does manifest in the undertreatment of Black children, especially when they present with pain, or other symptoms, so healthcare provider says, they can take it. But a little white kid walks in, and then they're all of a sudden gentle and kind and caring and saying, let's be thorough here. And the healthcare providers may minimize the child's concerns or delay diagnoses, leading to worse outcomes for pediatric conditions. Yeah, we could be talking about life or death here, but we're definitely talking about it on the minimum basis, dignity, respect, and compassion. Okay, number 3, Black patients are less likely to adhere to mental health treatment. I think that still goes with the other one as well. But this stereotype discourages healthcare providers from offering mental health referrals or medication or long-term support. And this can lead to underdiagnoses and undertreatment of mental health conditions like anxiety, depression, or PTSD for Black patients. Yes. So I don't know why. I think that still goes back to trust. But it also means that the patient, we haven't been haven't received a full explanation of what's going on with this, why this mental health treatment is necessary. Okay, so I think we have, let's see, I have a whole long list here, but I don't want to give too many because it's been a long day. Oh, but I can't ignore this one. Okay. Oh, this will be the last one. Black patients are more sexually active and at a higher risk for STDs. Well, you know how they think of us. This assumption may lead doctors to disproportionate screening of Black patients for STDs while neglecting other important aspects of our health. This also creates an undue stigma around sexual behavior that doesn't apply equally to other racial groups. I remember when I was in college, that was brought up quite a lot to me, even though there wasn't any issue with that. But it wasn't brought up to my white friends. They looked for other things first. Then that may have come up. I mean, if an STD is a disease like any other, but the doctors started with other things first with their white patients. With the Black patients, that they were seeing, and the Black student patients they were seeing, they always started with, it's an STD. So, and that did delay treatment, and they didn't say it in it's a disease like any other. No, it was it's because of your lifestyle, really kind of being really very disrespectful. So I think we're going to stop with those. You know what? I have, like I said, a long list of about 15 of these, and there could have been much longer than that. But if you want to see more of them, I'm going to put this list on my blog page on the Espresso Talk Today website. Okay, so go take a look there if you want to go deeper into this or see the full list, and I hope you do, because it's important. You can just scan the list pretty quickly and see if you recognize any of these in your experience. So that is all for today. I know it was a lot, but it is important to discuss medical racism. We can't be silent about the racial chaos or the racism that we experience anywhere, anytime, or with anyone. And it absolutely has no place in the healthcare system. We know it's there. And many of us have experienced it. I have too, on multiple occasions. So it's time to speak up and to speak out, but it does begin with awareness. And that's why I took this extra time to do this. So asante sana for joining me today on Espresso Talk Today. And really, if you found this episode meaningful, please, please, please share it with your friends or family or your whole community. Let's spread the word and inspire other people to take action. And let's inspire each other to take action. Recognizing these red flags is the first step in protecting ourselves from racial chaos in healthcare. But I'm not done with it yet. In the next episode, we're going to talk about specific strategies for confronting these situations and advocating for yourself. That is so important. And but it does begin with having some kind of awareness in the beginning. And let's see, the key takeaway here really is, to want to stay focused, is you have the right to be heard, respected, and treated with dignity. These red flags are real. And if you notice any of these red flags, don't be afraid to ask questions, seek a second opinion, or always bring an advocate with you to appointments. Your health and your life really can depend on this. I don't want to this is a kind of a sneak peek into what I'm going to talk about next time, but I just want to throw that out to you now. Remember that racial chaos in healthcare is not just about individual doctors or nurses. It's a part of a larger systemic issue. But by recognizing it and confronting it, we can take back control of our healthcare and demand the respect and care we deserve. Be sure to tune in next time to discuss how to confront racial chaos and advocate for yourself in the healthcare system. And if you want to keep discussing these issues or reading about them, then please subscribe to my weekly newsletter. It's a Black Empowerment newsletter. Yes, that's right. We're Black Empowerment here, the No Mo Beat. We discuss lots of different issues there. You can get your dose of Black Empowerment and liberation every week. I promise it's never a dull moment, but there'll be lots of powerful, uplifting, and liberating moments. You can subscribe at the Espresso Talk Today website at espressotalktoday.com or on Instagram at Ama Robin L. That's Ama, A-M-A, _ Robin, R-O-B-I-N, _ the letter L. You can also find us on Facebook at the Espresso Talk Today Black Liberation Lounge. This group is a safe space for us to hold discussions, share thoughts and ideas, feel joy, express sadness, or just be. Everyone needs a place to be. And you can join us on Instagram, where I hold a live discussion every week, and I'm putting out new information about this stuff every week, about the racial chaos in predominantly white spaces. And there are a lot of white spaces, so I'm all over the place. You can DM me to get the weekly schedule, or you can just join me on Instagram, again, at Ama Robin L. I'm Ama Robin for Espresso Talk Today. And remember, now more than ever, strength, soul, and reparations. Ashe, community.